This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. Our guest today is Dr. Jessica Lattman, a board-certified oculoplastic surgeon based in New York City. With over 25 years of experience specializing in cosmetic and reconstructive eyelid surgery, Dr. Lattman shares her expert perspective on how the eyes age, the difference between cosmetic and functional eyelid surgery, and how she tailors treatment plans to each patient's unique needs. She also walks us through modern lower eyelid blepharoplasty with fat transfer and offers thoughtful advice for anyone considering eye rejuvenation. And Dr. Lattman, we thank you for joining us here today.
Great. It is my great pleasure to be here, and I'm happy to address all these great topics.
And of course, we're certainly looking forward to hearing from you in all regards. So if you would, for starters, can you give us an overview of how the eyes tend to age and the changes that you typically see over time?
I guess to start, how the eyelids age. So they age pretty similarly to the rest of our body. There is loss of elasticity of the collagen, tendons, surrounding structures, so which kind of causes gravity to start to take over, things to droop. And then also a big part of the aging of the eyelids, which we also see in the rest of the face, is a loss of volume, meaning that the normal fat and structures that kind of give that nice baby face that we call sort of that round cherubic baby face, we start to lose that. So we get sort of hollowing of the upper lids and a droop of the upper lids. And then on the lower lids, you can get also a hollow, which causes a dark circle because, as you can imagine, the hollowness is like a valley. So if most of the light is coming from above, you sort of get a darkness and the hollowness of the valley. And then with the loss of elasticity, especially in the lower lid, you can sort of get a bulge above it, which is the normal fat that cushions the eyeball, sort of bulging out. It's not held back by the elasticity of the lower lid.
Yeah, really some helpful details and information on how the eyes tend to age and the changes that you see typically over time. Now, tell us also, when evaluating someone's eyes, how do you decide which surgical or non-surgical options are the best fit for that person?
Yeah, for sure. So in terms of non-surgical options, there's really only a few things you can do for the lower lid. One would be to restore volume non-surgically, and that would involve either filler, usually something like Restylane or one of the hyaluronic acid fillers, or fat transfer, which I would consider maybe a non-surgical. I mean, sort of non-surgical. It's easily done in the office to restore volume. And then the only other thing we can really do non-surgically would be to restore some elasticity and glow to the skin, and that would be with a laser resurfacing, something like a carbon dioxide laser, where it would help the quality of the skin. But okay, and then one other, which actually I just thought of, would be using Botox properly placed to help elevate the brow. And that is kind of a conversation in itself, how we can use Botox to kind of help elevate the brow. But basically, briefly, there are muscles in the face that work to depress or pull the brow down, and there are muscles that elevate the brow. And they're always in a push-pull. It's sort of like your bicep and your tricep, how it pushes and pulls your arm to move on the lever of your elbow. We can use Botox properly placed to help elevate the brow by weakening the muscles that pull the brow down and leaving the muscles that elevate the brow. So lots of different options for non-surgical treatments of eyelid aging. Yeah, these typically do work better on younger patients. So once you kind of get past a certain point, it's hard to really do much non-surgically.
Some great details right there. Most helpful. I'm sure the listeners appreciate that as well. Educational, no doubt. Now tell me also, what's the difference between cosmetic and blepharoplasty and functional eyelid surgery, and when might a patient need one versus the other?
Okay, so a lot of times when we talk functional versus cosmetic, cosmetic is purely to improve the appearance, meaning like my lids are heavy and I don't like how they look. Versus my lids are heavy to the point where the skin is hanging and it's obstructing my vision, or I am getting headaches because I have to use my eyebrows to kind of keep my eyes open. So I'd say it's really a matter of if we're doing it purely for appearance or for some other reason to help improve symptoms of eyelid aging. Does that make sense?
It certainly does make sense. Some awesome information shared with us so far. We're speaking with Dr. Jessica Lattman, a board-certified oculoplastic surgeon based in New York City, and she's joined us here today on Health Radio's Plastic Surgery.
How's this for a concept? At Luna Grill, we don't cook your food until you order it. That means you get fresh ingredients prepared fresh, just for you. Think of us as your own personal Mediterranean kitchen. Find us at lunagrill.com.
Information channel, a part of the eHealth Radio Network. Also, Dr. Lattman, can you walk us through cosmetic lower eyelid blepharoplasty and explain how a fat transfer is incorporated in this?
Yeah, absolutely. So when we're talking about lower eyelid cosmetic blepharoplasty, there are typically two approaches to use. One, and it's maybe a little too detailed, but one is called a transconjunctival, which means we're going through the inside of the eyelid and we are not making any incision on the skin side. And this works really well for young patients who just have a bulge or a hollow. And I can go in and in a really beautiful way treat their lower eyelid bulge by removing some of that fat. And then typically with that, if there's some hollowing, I will use fat transfer to fill in some of the hollowness. And this is a great option for patients. It's a very fast recovery and really easy healing and an easy surgery to go through. The other approach to lower lid blepharoplasty would be something called a transcutaneous, meaning going through the skin, where I make an incision across the eyelid underneath the lower eyelashes. And this allows me to, yes, access the bulging fat, which is causing the bulge, but it also allows me to take off some skin. So if there's extra hanging skin, and also support the eyelid, meaning to address drooping muscle or other things that maybe kind of gravity has taken over. And then also we can use fat transfer with this approach where we, again, harvest the fat, usually from the inner thigh, and then process it in a way where we turn it into micro droplets of fat. So it doesn't, like in kind of the early days of fat transfer, there was like problems with lumps and bumps. Not anymore the way that we process the fat, because it's really into nano droplets. And then fat transfer can be used like in conjunction with either the transconjunctival or the transcutaneous lower lid blepharoplasty. So it's really versatile. Or fat transfer can be used on its own, just to fill in the hollows, sort of like filler for the lower lids, but I like it much better than filler because it doesn't have a lot of the complications that filler can have.
Awesome feedback and information today. Really appreciate that. One last question. If someone is considering eye rejuvenation today, but they are hesitant, what advice would you give those types of people?
Yeah, so I think that it's definitely makes sense to feel hesitant or cautious about it, because the eyes are certainly front and center, and you want to make sure you are with someone who really knows what they're doing, in terms of that they do this all the time. And obviously I'm a little prejudiced, but I think it should be an oculoplastic surgeon, because we really understand the function and aesthetics of the eyelid, meaning that a lot of patients come in and they're like, I'm scared my eyelids won't close. I'm scared my eyelid's going to droop. When you're dealing with an oculoplastic surgeon who's doing the surgery, we are trained both as an ophthalmologist. So I did an ophthalmology training and a plastic surgery fellowship. So we have that depth of knowledge about the health of the eyelid, how the eyelids function, so that we can really safely do your surgery without worrying about complications of the function of the eyelid. And then I think it's really important to make sure your surgeon matches your aesthetic. Like, do you want to look more on the natural side, more on the done side? I mean, I'm personally more of have a natural aesthetic. So, my feeling of a successful surgery is that, no one knows anything was done. You just look good. So I think you need to make sure that the surgeon knows what they're doing in terms of function and aesthetics, and also aligns with, your goals.
Well, Dr. Lattman, we certainly appreciate what you do and for taking a moment to be with us here today. Really some great information and advice for those folks that are considering eye rejuvenation. Tell us, where can listeners get more information on your practice there in New York City, and how could listeners also be in contact as well?
Yes, it's drjessicalattman.com. You can check my website out, Google me, and we do accept patients calling, sending in photos. So I'm happy to help in any way I can.
And of course, listeners, you can pick up that link within the show notes of this broadcast for your convenience at any time. Again, it is drjessicalattman.com. Dr. Lattman, all the best, and look forward to another conversation right here on the Health Radio. Thanks so much for your time today.
It's my pleasure. It was enjoyable talking to you.
And certainly glad to hear that, and you're more than welcome anytime. Again, we've been speaking with Dr. Jessica Lattman, a board-certified oculoplastic surgeon based in New York City. And again, the website of reference is drjessicalattman.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the Health Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more Health Radio reports, we invite you to visit our main radio channel site at healthradionetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit ehealthradionetwork.com.